Hello, how are you? For this video, I will be talking about the parathyroid gland. So without further ado, let us start with our discussion with the lecture. Right. So parathyroid glands are located near the thyroid capsule. Okay, as you can see this, no, this is our thyroid, which we were able to talk about last meeting. So for this parathyroid glands, they are just found near the thyroid capsule. So here are the uh, parathyroid glands. So we have the super parathyroid gland and the inferior parathyroid gland. So most people have four parathyroid gland, but some have eight or as few as two. So take note that your parathyroid glands are the smallest endocrine gland in the body. And of course, from the term itself, parathyroid, tinatawag natin ang hormone na ina-express nila as parathyroid hormone. So the primary role of our parathyroid gland is to prevent hypocalcemia. Okay, so it promotes bone resorption and it increases renal reabsorption of calcium. So ano ba ang bone resorption? So take note that the bones are the major storage of our calcium. So when there is hypocalcemia, that refers to our calcium level in the blood. So when there is low levels of calcium in the blood, there is bone resorption, meaning there is breakdown of your bone cells so that there will be release of calcium from the bone into the bloodstream. So your calcium actually stimulates conversion of vitamin D to activated vitamin D3. So it is actually indirectly stimulating intestinal reabsorption of your calcium, no? Si parathyroid gland or the parathyroid hormone. Okay, so we have two conditions related to parathyroid gland. You have the hyperparathyroidism and the hypoparathyroidism. So for hyperparathyroidism, it is your primary hyperparathyroidism is the most common cause of hypercalcemia. So of course, now because the main function of our parathyroid hormone is to what we call release no calcium into the bloodstream. So kapag may hyperparathyroidism ka, so you will of course expect for hypercalcemia. So it is due to the presence of a functioning parathyroid adenoma. It is accompanied with phosphaturia and severe demineralization may occur kasi nga your bones will be demineralized because of the hyperparathyroidism. So for the lab results, there will be increased parathyroid hormone, increased ionized calcium, hypercalciuria, and hypophosphatemia. So yung phosphate mo kasi tsaka calcium, they have an inverse relationship. Every time your calcium is increased, your phosphate will decrease. Okay, kaya nga may phosphaturia siya, meaning there will be an increased level of phosphate in your urine. So we have secondary hyperparathyroidism. It develops in response to decrease in serum calcium. So diffuse hyperplasia no, of all four glands. So there will be, what are the causes? So first, there is vitamin D deficiency and chronic renal failure. Okay, so lab results, increased parathyroid but decreased ang ating ionized calcium. For hypoparathyroidism naman, it is due to accidental injury to the parathyroid gland during surgery. Other cause would be autoimmune parathyroid destruction. So individuals are unable to maintain calcium concentration in the blood without calcium supplementation. So we have your primary causes of hypothyroidism. It can be because of an autoimmune destruction which leads to autoimmune destruction or absent parathyroid glands. And secondary causes of hypothyroidism, we have radiation or surgery damage or low magnesium levels. Okay, so PTH normally interferes with bicarbonate reabsorption in the proximal tubule. Therefore, the renal tubular bicarbonate threshold tends to be increased in hypoparathyroidism. Low parathyroid hormone causes elevated bicarbonate reabsorption, which can lead to alkalosis. Best method for PTH measurement involves the use of antibodies that detect both the amino terminal fragment and the intact PTH. So that is the end now of our lecture for the parathyroid gland and its hormone. So just keep in mind, class, that our parathyroid hormone is associated with calcium, no? So when there is increased parathyroid hormone, there is increased calcium in the bloodstream. If there is decreased parathyroid hormone, there is decreased blood calcium in our bloodstream. Okay, so just keep that in mind, and um, take note also of the relationship between your parathyroid hormone, your calcium, and your vitamin D. Okay, so that would be all. Thank you so much, and God bless you.